Altitude sickness or acute mountain sickness is a fairly common problem when travelers go to above 8,000 feet. It happens to about 20% of individuals, and there are some things that you can do to help prevent it. The most important thing is to make sure when you're traveling that you go slowly. As you start to move up in altitude, that you go slowly. If you can try to not go up higher than 1,000 feet per day, that can be helpful. If you do notice that you have some of the signs of altitude sickness, and they include things like headaches, especially in the front of the head, a throbbing headache in the front of the head, difficulty sleeping, problems with appetite or feeling like you're going to throw up, just achy, almost like flu-like or hungover symptoms, assume that this is altitude sickness. Don't assume that it's a hangover, that it's some kind of flu, or always assume that it's altitude sickness. And the most important thing is you don't want to go to a higher altitude. So if you're at 8,000 feet and you're starting to have these symptoms, don't the next day go up to 9,000 or 10,000 feet. Very important. If a person has acute mountain syndrome and they end up having difficulty breathing at rest, or they're confused, or they have difficulty walking a straight line. You say you're walking, you have difficulty staying straight. That's a sign that's an emergency, and that's when a person needs to immediately come down to a lower altitude. And the problem is you got to look out for each other, because you can be unaware of this. Your mind is not working properly when you develop this high altitude cerebral edema or this pulmonary edema. You're just not thinking properly. So whenever you're at high altitudes with friends, you got to keep an eye on each other to prevent these things from happening. There are some medications. Acetazolamide is a pill. Acetazolamide can be taken before you ascend, about a day before you go up to altitude. It's not recommended for just kind of normal altitude trips unless you've had repeated cases of high altitude sickness, or say you're having to take a flight into Lhasa or La Paz up to a high altitude and you just don't have any choice. The best thing is to do the prevention, to go up to 8,000 and then to go up to 9,000, and each day to go up by 1,000 feet. But if you don't have any choice, then sometimes you have to use the medication. So the key is, if you're going to be at altitude, make sure that you do it safely. You want to avoid having some kind of crisis occur where you've got to be evacuated from the mountain. The 3 golden rules of preventing acute mountain illness from becoming a tragedy. First is, always assume, if you're having symptoms, headaches, if you're having problems with sleeping, fatigue, don't think it's something else. Always assume that it's acute mountain illness until proven otherwise. And then never, ever go higher in altitude if you have this altitude sickness. And then if you develop either the cerebral edema, the confusion, or the ataxia, the inability to walk straight, then you need to come down immediately, even if it happens in the middle of the night, by 1,000 feet. And if you have any of the signs of difficulty breathing at rest, that is a medical emergency. You need to get down to a lower altitude right away. So enjoy your high altitude trips, but make sure that you're on guard for some of these potential problems. That's a Minute for Health.